Hi, I'm Dr. Candace Anthony, a licensed professional counselor, and I'm here to talk to you today about therapy. Specifically, we're going to talk about what to expect within the first therapy session. First, let's describe the difference between a consultation session and an intake session. So a consultation session will last about 10 to 20 minutes and involves you and a therapist sharing a little bit about each other so you can decide collectively if it's worth working with each other for your therapy journey.
If the fit does not seem right, you can thank them for their time and move on. If the fit seems good, then the next step is an assessment.
Next is the intake session. Now, an intake session could last anywhere between an hour to 2 hours and goes a little bit more in depth with the therapist grabbing some historic information about you, your concerns, and what brought you to therapy in the first place. Next, let's talk about the questions you should be prepared to ask a therapist in your consultation or intake session. First, you want to ask your therapist about their approach to therapy and what experience they have helping someone like you. This is important for you to know so that you can have a better understanding about what work would look like specifically with this therapist. Next, you want to talk about the cost of therapy and the different options you have to pay for the therapy sessions. There's insurance, there's private pay, and then some therapists even offer a sliding fee scale that could be of benefit to you as well. Last, you want to ask the therapist what states they are licensed in. This is because with the rise in telehealth, a therapist can be licensed in a state that they're not physically located in, and you want to make sure that the therapist that you're seeing is licensed in the state that you're in. Now, let's talk about the questions you should be prepared to answer in the consultation or intake session. You want to be prepared to talk about the concerns and symptoms that you're experiencing, including how often they happen, how long they happen, and then also how intense that you're feeling them. Next, the therapist will also want to know about any previous experience you have had with therapy. This includes inpatient and outpatient therapy, individual group therapy, and even if you've had any experience with taking medication in the past. Last, you want to talk about who you are in general. This will help the therapist come to an understanding of who you were outside of your symptoms and help with building goals and setting up the interventions for therapy. Stepping into a new environment and being vulnerable can be a challenge for anyone. Hopefully this video has provided you with some insight that would make stepping into therapy a little bit less of a mystery.
For more information, please check out the resources linked below.